Good evening and welcome back. I need you to stop scrolling for the next few minutes and actually listen, because what I'm about to walk you through could genuinely change the direction of the rest of your life. Not in some vague, someday kind of way. I mean starting today. Starting with your very next decision. Welcome to the channel where we take what is genuinely understood about aging well and longevity and translate it into something you can actually use in your own life, starting now. After more than 2 decades practicing geriatric medicine, I have sat across from thousands of patients in their 60s, 70s, and 80s, and I have watched many of them make the same handful of mistakes over and over, quietly, without anyone ever sitting them down and explaining why these particular habits were working against them. Mistakes that were slowly chipping away at their strength, their mental clarity, their independence, and the quality of life they had every right to keep enjoying fully. Today, we're changing that. I want to speak to you directly for a moment, because I know who tends to watch this kind of content. You are someone paying attention, someone who refuses to simply accept that getting older automatically means getting weaker, slower, foggier, less alive. Maybe you've noticed your energy isn't what it used to be. Maybe your joints ache more in the morning than they did a few years back. Maybe your memory feels a little less sharp than it once did, and that has quietly started to worry you. I see you, and I want you to know that almost everything I just described is not a fixed destination. It's a direction, and directions can be changed, often more easily than people assume, at almost any age. Before we dive in, I want to tease something. The very last item on today's list is something nearly every senior does automatically every single morning, without thinking twice about it, and most doctors never tell their patients to reconsider it. It is that deeply built into how we've all been taught to start the day. Stay with me to the end, because that final one might genuinely surprise you. And before we start, drop your age in the comments and tell me the one health habit you're most proud of maintaining in your senior years. I read every comment on this channel, and your answers genuinely shape what I cover next and inspire other people reading them. Let's get into it. We're counting down from 7 to 1, building toward the habit that matters most. Number 7, eating 3 large meals a day. This one sounds completely harmless. 3 meals, breakfast, lunch, dinner. It's what most of us were taught growing up, and it's still printed on plenty of nutrition handouts. But here is what often gets left out of that conversation. After the age of 65, your digestive system genuinely slows down in several measurable ways. Gastric acid production declines. Digestive enzyme output decreases. Your gut's ability to efficiently process and absorb nutrients from one large meal diminishes compared to when you were younger. So when you sit down to a big dinner plate the way you always have, your body often isn't processing it as efficiently as it once did, which can leave you feeling sluggish, bloated, or unexpectedly tired afterward. A more age-appropriate pattern that many geriatric specialists now recommend is shifting toward 4 to 5 smaller, nutrient-dense meals spread evenly across the day, rather than concentrating most of your calories into 1 or 2 large sittings. Think of your digestive system after 70 a bit like a smaller engine. It doesn't necessarily need less fuel overall. It often runs more efficiently when that fuel arrives in smaller, more frequent, manageable amounts. I had a patient I'll call Margaret, 74 years old, who came to me exhausted and uncomfortably bloated after nearly every meal, genuinely worried something serious was wrong. When I reviewed her eating pattern, she was having a small breakfast and then one very large dinner, which tends to be one of the harder patterns for an aging digestive system to manage well. We restructured her day into 5 smaller portions, each built around protein and healthy fats. Within a couple of months, her energy had genuinely transformed, and she told me she felt noticeably lighter and more like herself again. The practical takeaway: aim for meals roughly every 3 to 4 hours, rather than 3 widely spaced large ones. Try to include at least 25 to 30 grams of protein at each meal, because after 70, your muscles become somewhat less efficient at responding to protein. A phenomenon sometimes called anabolic resistance, which generally means you need a bit more protein per pound of body weight than you did decades earlier. Pair each meal with a small amount of healthy fat, like olive oil or avocado, which supports absorption of the fat-soluble vitamins your bones and immune system depend on. Number 6. Taking long, hot showers every single day. I can already feel some resistance to this one, and I understand it. A hot shower feels good, but stay with me, because once you understand what prolonged heat actually does to aging skin and circulation, you may genuinely look at your shower routine differently. As we age, our skin produces noticeably less natural oil. The sebaceous glands slow down, and the skin barrier becomes thinner and more delicate overall. Hot water, particularly with prolonged exposure, strips away what remains of that protective lipid layer, contributing to what dermatologists call increased water loss through the skin. In plain terms, it dries your skin out from the inside, which over time can contribute to chronic dryness, itching, and a weakened protective skin barrier in older adults. There's a second concern that genuinely matters to me as a physician. Hot water causes your blood vessels to dilate rapidly, which can produce a sudden, noticeable drop in blood pressure. After 70, the cardiovascular system's ability to compensate quickly for these sudden pressure shifts tends to slow down. This is a frequently underappreciated contributor to dizziness and falls in the bathroom, which already happens to be statistically one of the more hazardous rooms in the home for older adults. The fix is straightforward. Lower your water temperature to comfortably warm rather than genuinely hot. Try to limit showers to around 8 minutes or less. Apply a moisturizer containing ceramides immediately afterward while your skin is still slightly damp, which helps lock in moisture. And consider finishing with a brief 30 seconds of cooler water, a practice sometimes called contrast hydrotherapy, which some research suggests may support healthy vascular tone and reduce overall fatigue in older adults. Number 5. Avoiding resistance training because of joint pain. This is one of the more dangerous myths I encounter regularly in practice, and it genuinely costs many seniors years of functional independence they didn't need to lose. The instinct makes intuitive sense. If your knees hurt or your hips ache, rest seems like the responsible choice. But the underlying physiology tells a different story. Your muscles and joints function as partners. When surrounding muscles weaken, they place more stress on the joints they support, not less. Avoiding resistance training after 65 tends to accelerate sarcopenia, the age-related loss of muscle mass, which without active resistance training can progress meaningfully year over year. That muscle is precisely what keeps you upright, helps prevent falls, supports a healthy metabolism, and helps maintain bone density. Research on progressive resistance training in older adults, including programs involving people well into their 80s and 90s, has consistently found meaningful improvements in strength, balance, and walking speed after just several weeks of consistent twice-weekly training, with many participants reporting reduced joint discomfort rather than increased pain. The pattern researchers keep pointing to is that frailty, not age itself, tends to be the real driver of decline. And frailty is often genuinely reversible with the right kind of consistent movement. I worked with a patient I'll call Harold, 81 years old, who came to me convinced his body was simply falling apart. He had stopped walking more than a block because his knees hurt too much. We started him on a simple chair-based resistance program using light resistance bands, just twice weekly, 20 minutes a session, focused on large muscle groups. Several months later, Harold was walking a mile most mornings. He told me he hadn't felt that kind of physical freedom in years. Start with seated resistance exercises using light bands or your own body weight, focusing on the large muscle groups, thighs, glutes, and back. And here's a useful synergy tip. Try to have a protein-rich meal within roughly 30 minutes of your resistance session. That post-exercise window tends to be when your muscles are most receptive to using available amino acids for repair and growth, and for seniors managing anabolic resistance, that timing genuinely seems to matter. Number 4. Relying entirely on reading glasses and never doing any vision training. Here's something worth knowing. Vision, somewhat like muscle, can respond to consistent practice within certain limits. The lens of the eye and the small ciliary muscles that adjust its focus do weaken with age, a condition called presbyopia, the medical term for age-related difficulty focusing on near objects. Most people simply accept this, move to progressively stronger reading glasses, and assume the decline is entirely inevitable. But those ciliary muscles are still functioning muscle tissue, and some research suggests that regular near-far focusing exercises, combined with adequate intake of lutein and zeaxanthin in the diet, may produce modest, measurable improvements in reading comfort and visual clarity for some older adults over a period of weeks. This won't replace your glasses, and I want to be honest about that, but it may help slow the rate of progression for some people and potentially reduce dependency somewhat over time. Beyond the lens itself, your brain's visual processing also tends to slow gradually with age. Contrast sensitivity, your ability to distinguish objects from their background in dim lighting, can decline meaningfully after 70, which is one of the contributing reasons falls happen more often in poorly lit environments. Practicing simple visual focusing exercises, making sure you're getting adequate zinc and vitamin A, and improving the lighting throughout your home are all reasonable low-risk strategies that most seniors are simply never told about. If this channel has ever given you information your doctor didn't have time to mention, hit the like button and subscribe if you haven't already. It genuinely helps this reach more people who could use it, and it costs you nothing. Number 3. Sleeping more than 9 hours regularly or relying on over-the-counter sleep aids night after night. This one surprises people because we all know sleep matters for healing and recovery, and it absolutely does. But the relationship between sleep duration and healthy aging is more nuanced than most people realize, and getting it wrong can quietly affect brain health over time. Sleeping considerably longer than the typical recommended range is not, in itself, harmful in a direct sense. But chronically long sleep duration in older adults is often a symptom of poor underlying sleep quality rather than a sign of deeply restorative rest. Fragmented sleep cycles with insufficient deep sleep don't allow the brain to complete its overnight maintenance work as effectively. Your brain has a genuine waste clearance system, sometimes called the glymphatic system, that becomes most active during deep sleep stages, helping clear metabolic byproducts that accumulate during waking hours. Spending 9 or 10 hours in bed but cycling mostly through light, fragmented sleep often means you're missing much of this restorative deep sleep window despite the extra time spent lying down. As for sleep aids, particularly common over-the-counter antihistamine-based products containing diphenhydramine, the research here deserves genuine attention. A well-documented study published in JAMA Internal Medicine found a meaningful association between cumulative, regular use of strongly anticholinergic medications, including diphenhydramine, and increased dementia risk in older adults. These medications cross into the brain and reduce acetylcholine activity, a neurotransmitter central to memory function, and with repeated long-term use, this may contribute to lasting changes in brain chemistry. This is a genuinely important finding worth discussing directly with your physician or pharmacist if you regularly reach for these products to fall asleep. I had a patient I'll call Dorothy, 78, who was sleeping 10 hours nightly and still waking up exhausted. She had been taking a common over-the-counter sleep aid for 3 years. When we ran cognitive screening, her scores had been quietly trending downward. We worked with her physician to gradually taper the medication, introduced a more consistent 7-hour sleep window, added magnesium glycinate before bed, and addressed her sleep environment. Within several months, her cognitive testing improved, and she told me the mental fog she'd been living with for years had genuinely begun to lift. If sleep is a struggle, focus on consistent sleep and wake times every single day. Keep your bedroom cool, somewhere around 65 to 67 degrees Fahrenheit. Avoid screens for roughly an hour before bed. Consider 200 to 400 milligrams of magnesium glycinate about 30 minutes before sleep, paired with chamomile or passion flower tea, both of which have some traditional and preliminary research support for promoting calm, restful sleep without the risks associated with regular antihistamine use. Always discuss new supplements with your doctor first, particularly if you take other medications. Number 2. drinking less water simply because you don't feel particularly thirsty. This may be one of the more overlooked health concerns among seniors today, and part of what makes it genuinely risky is precisely that it's invisible. You typically don't feel it happening in the moment. Here's the biology. As we age, the hypothalamus, the region of the brain responsible for regulating thirst, becomes progressively less sensitive to the body's actual hydration status. By the time many adults reach their 70s, the thirst response has become noticeably blunted, meaning you can be meaningfully dehydrated while still feeling completely fine and unbothered. Even relatively mild, chronic dehydration in older adults has been associated with increased risk of urinary tract infections, which are a significant and underappreciated cause of sudden confusion and hospitalization in elderly patients. Mild dehydration also raises the risk of kidney stones, contributes to constipation, and can affect the concentration of medications in the bloodstream, since many common medications depend on adequate hydration to maintain stable, predictable blood levels. Some research has also found that even modest dehydration, too mild to consciously notice, can measurably affect short-term memory, concentration, and reaction time in older adults. A reasonable target for most seniors is around 6 to 8 cups of water daily, spread consistently throughout the day, rather than consumed all at once. Keep a water bottle visible and within reach throughout your home, and set a simple goal of refilling and finishing it at least twice by evening. Adding a small pinch of salt or a sugar-free electrolyte supplement to one glass daily can support cellular hydration for some people, particularly in warmer weather. Pairing your water intake with naturally hydrating foods like cucumbers, watermelon, and leafy greens adds additional fluid that the body tends to absorb effectively alongside plain water. And now, the moment I promised you. Number 1. The single habit nearly every senior practices every morning, almost entirely on autopilot, that quietly works against their own health, energy, and long-term brain function. That habit is sitting down within the first 30 minutes of waking up. I know that's not what you expected. Let me explain the reasoning because it's genuinely compelling once you understand it. The human body has what's known as the cortisol awakening response. In the first 30 to 45 minutes after you wake, cortisol, your body's primary alertness and activation hormone, rises naturally and substantially above its overnight baseline. This is essentially your body's built-in biological alarm clock, preparing your cardiovascular system, your brain, and your muscles for the physical and mental demands of the day ahead. For older adults specifically, this window appears to be a genuinely important part of the day's biological rhythm. When you sit down immediately after waking, whether in a recliner with coffee, at the breakfast table, or on the couch in front of the television, you are essentially signaling to your body that the physical demands of the day have already concluded before they've really begun. Some research examining activity patterns in older adults has found that those who remained largely sedentary during the first hour after waking tended to show higher rates of metabolic and cardiovascular issues over time, independent of how much exercise they fit in later in the day. This suggests that morning timing specifically may carry meaningful weight, beyond simply hitting a daily activity total. During that natural morning cortisol surge, cortisol also has anti-inflammatory effects, helping ease overnight joint stiffness and priming your muscles for movement. When you remain still through that window rather than engaging in some light activity, that cortisol circulates without being put to productive use. And chronically poorly regulated cortisol patterns over time have been associated with increased visceral fat accumulation, reduced bone density, and impaired immune function in various studies. There's also reasonable evidence that light physical activity shortly after waking can support healthy muscle protein synthesis throughout the day in older adults, even when that morning movement is gentle and brief. We're talking about something as simple as a 10-minute slow walk, some light stretching, or a few minutes of gentle standing movement, the kind of gentle activity that wakes the body the way it's naturally designed to be woken. I want to tell you about a patient I'll call Robert, 77 years old, retired for over a decade. He had settled into a deeply familiar routine. Wake up, pour coffee, sit in his recliner, watch the morning news for an hour. He told me he had no real energy most mornings. His joints ached for the first couple of hours of every day. He felt mentally foggy until early afternoon. His blood work showed some elevated inflammatory markers and borderline glucose levels. We made one change, just one. For 21 days, Robert committed to a 10-minute walk outside within 15 minutes of waking, before the coffee, before the recliner, before the television. Then he came back inside and went about his day exactly as he normally would. Within 3 weeks, he called my office, and I genuinely won't forget what he said. He told me, "I feel like someone turned a light back on inside me." His morning joint stiffness had eased considerably. His energy through the middle of the day had improved. One change, 10 minutes, 3 weeks. There's a useful synergy here worth mentioning. The moment you step outside or stand near a bright window during that morning movement, natural light exposure helps anchor your circadian rhythm for the entire day, which in turn tends to support healthier melatonin production that evening, more stable mood, and for some people, reduced symptoms of seasonal mood changes. Morning movement combined with morning natural light is one of the simplest, lowest-cost interventions available in healthy aging, and it remains something almost nobody is told to prioritize. Now, let me bring this together for you, because this isn't really about isolated facts and statistics. It's about your life. It's about whether you spend the next decade watching it pass from a chair, or whether you remain genuinely present, capable, and independent in every room you walk into. I have watched patients well into their 80s make meaningful improvements in conditions they'd been told were simply permanent features of aging. I've watched people who could barely manage a walk across a parking lot become regular daily walkers within months. I've watched mental clarity return to people who had quietly started to feel afraid of their own minds. And in nearly every case, the real turning point wasn't a medication or a procedure. It was information, the right information, applied consistently over time. You have that information now. 7 changes that cost nothing, require no prescription, and can genuinely begin today. Your body isn't betraying you. It's responding to the inputs it's consistently given. Change those inputs, and you may be genuinely surprised by what your body still has the capacity to do. If anything here connected with where you are in your own life right now, share it with someone you care about who might need to hear it too. This is Dr. John. Take care of yourselves, and I'll see you in the next one.